over the last 10 or 15 years, we've tried to transition medicine and the communication of medicine away from paper more to electronic digital medicine, with the notion that we'd be improving quality of care along the way. The trouble with the whole thing is that we have multiple systems within these electronic databases that don't talk to each other. So we have silos of data all over the place and no ability to integrate that information and no ability to make it easier really for the patient or the physician teams that often take care of patients. What we're doing is we're having patients come in for their appointments, and then they have an option to sign up to Brightsquid. And Brightsquid, I think the best way to think of it is really a secure email platform that allows me as the practitioner to communicate directly with the patients and to respond to them securely. So it really empowers the patient to be directly involved, and they can actually invite others onto their secure mail account to then share that information. So it's really a brilliant way to kind of have a secure network of communication that facilitates medical care and medical communications. They appreciate that respectfully they're actually given their information. Now they're fully engaged in a conversation. I think they understand more, and we're in a time of sharing information. So I think it's time for medicine to move along that continuum and actually embed the patient's medical informatics as part of a routine part of any visit. No, they're very respectful. In fact, the emails that are sent are generally coming to the front office, and that allows the patients to not have to wait on the phone, make 15 calls, or for my staff to call them back 10 or 15 times or leave messages. So it really facilitates the ease of communication just from a pure practical point of view. Patients like it, specialists like it, primary care like it, because the waiting time is less, access is improved. People aren't coming back to fill a prescription. They're not doing things that they would have to do in the past. We can do most of that by using secure mail. For healthcare to improve in North America, it's all about embedding the patient in their own care, making sure that they're part of the responsibility, that they have the data, that they have the information, that they're empowered to be a good communicator, that they end up with sources of truth that help us be safe, that help us provide timely, great access to care. So I don't think it's about spending more money in healthcare. I don't think it's about building more hospitals. I think it's all about kind of coordinating all these disparate silos of care. We need to better spend the dollars in healthcare, and this is a perfect tool.